Justine.
Thank you, Madam Speaker. I also welcome the opportunity to talk about health here in the Northern Territory and thank the Leader of the Opposition for bringing this important issue to the Chamber. And like the member for Mulka, I want to begin by thanking our incredibly hardworking and dedicated health workers, nurses, doctors, health workers, allied health professionals and everyone who works tirelessly to look after all the health needs of our communities. These professionals are the backbone of our healthcare system and their efforts are nothing short of heroic. In a roundabout way, health actually brought me here to the Northern Territory. I first came here 30 years ago to visit my brother, who'd come here as a young doctor, drawn like so many by the complex and acute health needs of our territory. And like so many people who've worked so hard for the health of the Northern Territory, he continues to have a connection here through Menzies. And through him, I gained an early insight into the health challenges that the Northern Territory faces, and what we're facing now is nothing new. We know that we face huge challenges addressing our unique social determinants of health here: access to housing, education, employment, social networks, healthcare, and wraparound social services. All of these are fundamental to improving health outcomes. And we must also acknowledge the cultural determinants of health across the Territory, which encompass the different ways that culture, traditions, values, and practices influence the health and well-being of individuals and communities. So it's really important that when we talk about health spending, we're not just talking about physical health, we're also talking about addressing these social and cultural determinants of health. To make meaningful progress in improving health outcomes, it's essential that we invest in upstream public health measures, in addition to the traditional primary and emergency healthcare services, which are so vital for the health of our current society. These upstream measures address the root causes of health issues, targeting the social, economic and environmental factors that contribute to poor health outcomes. Long-term generational investment in these initiatives can help reorient our health services towards more localised preventative health models. These models serve to improve overall health, prevent future health issues and reduce disparities, and ultimately lead to stronger, healthier communities. These are the critical elements of overall well-being. And as the member for Daly mentioned, we must also recognise the importance of working in partnership with local communities to develop appropriate healthcare solutions. We know that local communities have invaluable knowledge of their own needs, traditions and challenges, and involving them in the development and delivery of health service ensures that these services are culturally appropriate, accessible, and that they're going to work. Collaborating with local communities will help us tailor healthcare services to their specific needs and ensure better health outcomes for all of us in the long term. In my electorate, like so many of us, I see firsthand how many people struggle with accessing appropriate and timely health services and care. This is not just a local issue, it's a territory-wide challenge that does demand our immediate attention. The broader health needs of the NT are significant and urgent. Access to quality healthcare in remote and regional communities remains one of the Territory's most pressing issues. In fact, remote communities in the NT experience some of the worst health outcomes in the country. Life expectancy in remote areas is on average 11 years lower than in urban areas, with Aboriginal Territorians living 9.5 years less than non-Aboriginal Territorians. Over 30% of the Territory's population live in remote or very remote areas where healthcare services are scarce and access to primary healthcare is severely limited. And we heard about this from the member for Mulka. Residents in these areas often must travel hundreds of kilometres to access basic healthcare services, leading to delayed treatment, preventable hospitalisations and significantly poorer health outcomes. Emergency evacuations, which don't always go right, as we heard, due to inadequate local healthcare services, are an ongoing reality. For mental health crises, a lack of immediate local support can lead to emergency department visits, unnecessary hospital admissions, and exacerbate an already stretched system. Mental health services here in the Territory are in particular under-resourced. Over 25% of Territorians report experiencing high or very high levels of psychological distress, compared to the national average of 13.5%. Without early intervention and community-based mental health services, individuals often reach crisis point, overwhelming emergency departments and hospital services. Early intervention across our whole health system saves lives, reduces pressure on hospitals and ultimately saves the government significant resources. Funding must be targeted at supporting people before health reaches a crisis point, and we need to ensure that people receive timely care closer to home. As I said in my lecture, I hear from residents every day who are unable to access healthcare when they need it most. I just want to say again, I want to recognise the amazing work that our healthcare system does. I've been a very lucky recipient of incredible healthcare here in the Northern Territory in our public health system over, unfortunately, a myriad of health issues, and it's been incredible. The service that I have got has been amazing, and my family, and I just want to note that again. But we know that many people are unable to access healthcare when they need it most, whether it's really long wait times where the average wait for a specialist appointment exceeds 12 weeks, the lack of culturally appropriate services, the desperate shortage of healthcare professionals and the pressure that puts our healthcare professionals under. All these barriers are real and they're affecting people's lives every day. And the broader health landscape in the Northern Territory is equally concerning. Chronic diseases like diabetes, cardiovascular disease and respiratory conditions are more prevalent here than anywhere else in Australia. For example, the rate of diabetes in the NT is over 2.5 times the national average. Aboriginal Territorians are 4 times more likely to be hospitalised for diabetes-related complications. Aged care services are also under immense pressure, and we know that many beds in our hospital are currently taken up by people who actually need to be in appropriate aged healthcare services. The social services and wellbeing sector is the largest employer in the Northern Territory, and supporting this sector through targeted funding will enhance care quality and reduce stigma around health issues. We must prioritise health support for Aboriginal communities. Closing the gap in health outcomes is not just a policy goal, it's a social justice imperative. We heard from the Productivity Commission 2 weeks ago that the Northern Territory is going backwards against 8 of the closing the gap targets, including female life expectancy and birth weight. Aboriginal Territorians are 3.5 times more likely to experience avoidable hospital admissions and 2.5 times more likely to die from preventable causes than non-Aboriginal residents. Culturally appropriate services and support for Aboriginal health workers are essential components of any effective health strategy. And health is, of course, also closely linked to broader social issues such as housing, food, security, education and safety. Addressing these factors is critical to improving health outcomes. Policies that support safe, affordable housing, food security and healthy, violence-free relationships enable Territorians to manage their health more effectively and lead fulfilling lives. As we look at ways to improve health outcomes in the Northern Territory, we also must be acutely aware of the impact that industrial development can have on the health of our people, especially in our more vulnerable and remote communities. The risks posed by these industries are not abstract, they're very real and very immediate. As we continue to open up the Territory for business, and just to note, the member for Karama, I'm not opposed to private enterprise, I'm not opposed to building, I didn't say that, and I'm not opposed to building our economy, but I want to make sure that if we're opening up the Territory for business, we need to make sure that this business will not make us sicker. In 2023, Northern Territory paediatricians, hard-working practitioners who look after all of our children here in the Northern Territory, asked for research and evidence on the impact of oil and gas development on our health. They asked this because their pledge is to do no harm, and they were worried about the health impacts of this development on their patients. I remind this chamber that these specialists, these doctors, have pledged to do no harm, and their only agenda is to look after our sick children. I wonder if these are the people, the activists, that the CLP wants to leave the Northern Territory. The outcome of this research is clear. The risks of oil and gas development for human health, which I have here, anyone is welcome to look at it. A synthesis of evidence and implications for Australia shows us very clearly that extraction processes such as hydraulic fracking and drilling can have significant environmental and health aspects. These operations release harmful chemicals into the air, soil and water, all of which can directly affect public health. Studies have shown that exposure to these chemicals can lead to a range of health issues respiratory problems, cardiovascular disease and neurological damage, to name a few. People living in proximity to these operations, including in areas like the Beetaloo Basin and around the Middle Arm Precinct in Darwin Harbour, are at increased risk. Our healthcare system, already stretched thin by the demands of chronic disease and mental health challenges, will face even greater burdens as these health impacts begin to manifest. And beyond the direct health risks, the environmental consequences of oil and gas extraction are also of great concern. Contamination of water sources, disruption of local ecosystems, and the destruction of wildlife habitats could exacerbate the already significant pressures on our environment and on our communities. If our commitment is to continue to improve health outcomes in the Northern Territory, we must ensure that we're not trading one set of health risks for another. The Northern Territory cannot afford to ignore mounting evidence of these health risks. In closing, the health challenges we face in the Northern Territory are not insurmountable, but they require a united effort. We must continue to advocate for better healthcare services, chronic disease prevention, mental health services, and programs that break the cycle of disadvantage. We must also protect our environment from industries that threaten to harm our land, air, and water, and the health of the people who call this place home. Let's make health our priority, because our communities deserve nothing less. Thank you. And Mr. Deputy Speaker, I seek leave to table this report.
Is leave granted?
Aye. Thank you.